found out we're having a baby girl, so we were thrilled. And then come about 13 and a half weeks, we had a loss. So my story is I found myself going to medical school a little later in life and then finished all my training and became an anesthesiologist. I really enjoyed the practice and I became fascinated looking at patients' charts, and some seemingly healthy patients had a full list of medical conditions, and then other patients that look healthy were healthy on their chart. And just wondering why do some people have chronic disease and other people don't? And that brought me to functional medicine. My journey was great. I learned a lot about the root cause, like finding the root cause of disease and treating it that way, and that for many people having a lot of chronic problems, there's one underlying problem or two, like root causes to that problem, I should say. And then in my anesthesia career, I realized my hands were getting weaker. EMG showed I had carpal tunnel or have carpal tunnel nerve compression on the median nerve, as well as ulnar nerve compression on both arms. And I was deemed too weak to work as an anesthesiologist. Even though that was a big shock and definitely life-changing, luckily I had the functional medicine passion, and I came across a group in my functional medicine, a post that said, who wants to learn more about the functional medicine approach to fertility? Oh, absolutely I do. My husband and I were just going through a fertility journey ourselves and struggle, and I had thought about that might be the specialty I want to do. And then here it was, this question on our WhatsApp group, and the first course started on my birthday. I was like, okay, this is definitely meant to be. And I started and got to train with this woman who's a naturopathic doctor, Dr. Amatma, has this amazing program. She's worked as a holistic fertility specialist for many years and has things dialed in. And as part of the training with her, I was gifted the program. So I have this beautiful set of tools that has helped 85% of women 38 and younger get pregnant. It's unbelievable the success rate that this program has. So I'm so happy to have had that professional journey to be able to be where I am now to help patients who struggle like I did. As I said, my husband and I, we had our own journey. It started when we met at 40, and neither of us had had children, neither of us knew if we could have children, and we also had at that point the question in our mind, do we want to take the risk to have a biological child at our ages? And we did a lot of research, talking to colleagues, talking to ourselves, and came up with, okay, we're willing to. And we were so fortunate to have our son, who is with us now and turning 8 in October, and we were 42. So unbelievable that we were blessed with that, especially now that I know more, being in the fertility profession myself now. And then we struggled. We went through those same questions. Do we want to try again for a biological child, or do we want to adopt, which we had looked into adoption, and for us at our ages that just seemed like would be a really long road if we could even end up with an adopted child because of our ages, and also at this point because we already had a child, that our chances were even lower there. So we decided that we wanted to try to have another child biologically, and it took us quite a while to get pregnant for that pregnancy, maybe a year and a half. So it seemed like forever, especially with our ages. And we were so excited with the positive pregnancy test. We did the genetic testing at about 10 weeks, and that came back great. Nothing showed up on that test. We found out we're having a baby girl, so we were thrilled. And then come about 13 and a half weeks, we had a loss. And my heart goes out to any of you that have had a loss. It's just, I had no idea until we were there how devastating and sad. And we still miss her. We named her Lily Rose, and she's still part of our family. We have lilies in the backyard and roses in her honor. Our son talks about her. We celebrate her due date. We celebrate the day she left us, and we miss her. We miss her terribly. But I feel like a silver lining in that is that I've been through it and I know how painful it is, and my heart goes out to anyone that has had a loss, and the women that we work with that have had losses. I think I'm much better able to understand and have compassion for them now that I've been through that. So once we had our loss, I was in shock. Like, how do women, I see on women's charts in anesthesia, I saw on women's charts that they had up to 7, even more losses. They were pregnant that many times, and they still went on to try again. And I'm like, oh my goodness, at that point, I could not imagine the grief and the pain and the sorrow are so deep that I couldn't imagine how anyone could have the courage to try again. And interestingly enough, I went through a lot. My healing process was a lot in 3 months, and I feel like I really progressed in my healing process. And after about 3 months, I told my husband, I'm like, okay, I'm ready. I want a child. I want a child again. And honey, we were old before, but we're really old now, so we need some major help. And so we went to the IVF clinic. Our reproductive endocrinologist said, your best bet is donor egg. And at that point, I wasn't ready for it. And we had some more communication with her, and she said, well, your numbers look okay, and you had a pregnancy not too long ago, and if you really want to give it a try, we can, kind of thing. But she's like, your chances are very low. And I needed to do that. My husband was willing to go donor egg at that point, but I think I needed to give IVF with my eggs a try. So we did, and we had 6 eggs, 1 embryo, but it didn't progress enough to transfer. So that was another point of mourning, just being sad about our hopes and dreams that this would work, and it didn't. And probably about 6 months later, I came to the aha point in my life where I was like, I am ready. I want to do egg donor. Like, I want another baby. And so we went that route. And at the same time, I was working on my own, balancing my body and getting as healthy as possible, which I think was a big benefit for me, and ability to have our second baby, or second live baby, my third pregnancy, but our baby girl, and she's healthy, and we're so blessed and so happy to have her. So I guess I have experienced a lot in the fertility journey, a lot of different things. So my heart goes out to people who want babies, because I know that struggle and that passion. And I also know the losing hope, because for a while I lost hope, and I really needed things to shift, and I was trying to shift them on my own, and I couldn't make them shift as much as I was like, I have to think positive, and it wasn't happening. So it's a spiritual program as well, and a spiritual piece to the fertility journey. Absolutely. I just happened to, I threw it out there and said, okay, universe, I need help with this. Like, I've lost hope. I need hope. I know going into this donor egg process, I have to. That's a big piece of it. I need that hope. And it came to me. It came in the most mysterious way. A woman I barely knew. It was another parent of a classmate in my son's class, and I just happened to open up to her, and for some reason that conversation shifted things, and I had hope. With Baby Hope Fertility, one of my big passions is to help couples have regained or find that hope that it's very possible for them. And if you have hope, that's a big piece in it as well, because it's going to shift the chemicals in your brain and your body and help support your health by feeling that positive piece of hope. We combine the Western world and the Eastern world as far as medical treatments and looking at health and being able to get patients to a healthy state, as optimized as possible, and balance their hormones, their systems, your immune system. We need that to be balanced. We don't want any autoimmune processes, so your own immune system attacking your own body or attacking a pregnancy that's coming in. So we would want to work on an autoimmune piece, and then we can take the Eastern approach and the Western approach and combine that to offer more to our patients and more likely to help the healing and the process to come together for the best chances to have a healthy baby. Another piece of Baby Hope Fertility, which I think is amazing, is that we look at the male as closely as we look at the female. We know that healthy sperm is 50% of the equation, right? It takes the sperm, it takes the egg to make the embryo and the baby. And so we need healthy eggs and healthy sperm. And the healthy sperm come from healthy men. So we take a really close look at not only the semen parameters, which are very important and can give us clues to, hey, there's something behind this. Like, why isn't there semen analysis where we want it to be? Why isn't it optimal? Well, there's probably something else going on. And so whether that be inflammation in the body, whether that be the thyroid glands not working properly, whether it be a blood sugar issue, somebody's blood sugar needs to be stabilized. It can be a myriad of things, but we're able to take a really close look at the male, all kinds of labs, lifestyle, as we will do with the female as well. I think that's definitely a piece of Baby Hope Fertility that is very important and missing in some other aspects of looking at fertility from different angles and viewpoints. With Baby Hope Fertility, we actually see a myriad of couples. So I would say the most common are couples that have struggled to get pregnant and are struggling with infertility, who maybe had losses and unsuccessful pregnancies, or not been able to get pregnant at all. But we also work with couples, sometimes younger couples that are thinking about being pregnant in the future. So, hey, I'm in my 20s, but I'm thinking I want to get pregnant at some point, just not right now. And what can I do to have a healthy pregnancy and or preserve my fertility for the future? Another aspect that we look at are couples that are already going the IVF route or know that they need to go that route for some reason. And once in a while there's a man that has to be on testosterone, like exogenous testosterone. Well, we know that that couple's going to need reproductive endocrinology support to produce an embryo and have a healthy baby. Honestly, do most of my communication and working with patients virtually, but I also have a brick and mortar, so to speak, at Nurture. It's a well care marketplace in Denver, Colorado. If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.